Hello, I'm Robert. Welcome to my channel, where I help people who are scared of many things and also connect you to good, accurate information. And this time, you may have seen the viral tweet about Dr. Mike Ryan being very dismissive of the idea of having a wave now rather than delaying it to the autumn in the United Kingdom. So we hear this over and over, politicians saying we need to have the wave now because it'd be very bad if we have an exit wave in the autumn. So this is what he said. He doesn't believe it's their logic. And if it was the plan, then he calls it epidemiological stupidity if it's gone viral. So let's hear the video.
To Ryan, another question about the UK change of policy, because I think it's been watched around the world. Part of the government's reasoning, they say, is that if they have an exit wave now in August, it's better than having one later in September. So they're gambling on cases going up sharply and then falling back down pretty sharply. Could you just explain to me a bit more about whether you think that's too hopeful or whether, that there is some good grounds to believe that will work?
Thanks for the question. I'm not aware that that's the logic driving our colleagues in the United Kingdom. I suspect it's not. I would like to verify that that's the logic, but the logic of more people being infected is better is, I think, logic that has proven its moral emptiness and its epidemiological stupidity previously.
So that's all he said. If you're in the United Kingdom, you've probably heard our politicians say that over and over again, and just the moral emptiness and epidemiological stupidity of going for having the wave now. And this is especially striking because many of these people will be vaccinated if the UK government waits just a few more weeks. By September, all adults and adolescents in the UK will be offered the vaccine. This is a letter from medics and scientists about it, and which we could talk about. But anyway, this is Rachel Clark, a palliative care doctor, and she says that the hospitals are already seeing increasing in hospital patients with COVID. And for instance, in Leeds Royal Infirmary, then all the intensive care units were already taken with COVID patients, so they have to turn away people who are needing life and death, what does she actually call it? Life and death surgeries for cancer. So very important surgeries that are having to be delayed for people who have got cancer and need the cancer removed because of all the COVID patients. And they're saying to slow down and wait until a higher proportion of the population are properly vaccinated. So the answer is quite simple. Then they say, you get the government saying, well, if we don't do it now, when will we do it? And the answer is very obvious. When we do it is when the people are vaccinated. They should get the immune response to being vaccinated, which is actually a stronger immune response than natural immunity. Not get an immune response by becoming sick, and many of them ending up in hospital, and some of them dying, and 15% to 20% of the adults and 8% of the children ending up with long COVID. And long COVID, some children have had long COVID for 15 months since the start of the pandemic in the United Kingdom, and we just don't know how long it will last for. It may be that some of our children will have fuzzy thinking and difficulty in breathing and fatigue, potentially for years in the future. We just don't know. It's too early to know the long-term effects of long COVID. And then we've got the people dying, and it's already spreading to the more elderly people. If you look at the vaccination curves, it's 95% of the over 80, I think, It goes down as you go down to lower age groups. And the over 80, that means 1 in 20 of the older 80 either didn't want to be vaccinated or can't be vaccinated, and that means their risk of dying, a significant risk of dying, if this gets to them. And as it goes down the age groups, then the higher percentage that are not vaccinated. And if you have a high level of vaccination in the population, then that will slow it down because it's also stopping transmission. And then it's also protecting all the people who are vaccinated. So it's very, very simple. And they keep talking over and over again about this exit wave, and they say we need to make sure the exit wave is now in the summer, because if we delay it to winter, then it's the same time as the flu wave. That's what our government keeps saying. I don't think this is what the scientists are saying to the government, not the sage scientists. I don't think many of them are saying this. I would hope not. As Dr. Ryan said, I would very much hope that they're not saying that. But if you look at this is Israel, and they controlled the Alpha variant. They went all the way down. They opened up completely, no masks or anything. Gradually, eventually stopped all masks sometime around then. There was no exit wave. This little bit of a rise now is not an exit wave for Alpha. This is because Delta is coming into Israel, and Delta is the Pfizer vaccine, recent research from Israel, that it's about 95% effective against Alpha in stopping even asymptomatic infection, but the Pfizer vaccine is only 64% effective at stopping transmission, asymptomatic infection for the Delta. So Israel are finding that vaccination alone is not enough to stop Delta. So they're going to have to start imposing some probably light level of things like wearing masks and so on whenever you have an outbreak. So we're probably going to need a booster shot because of Delta, and there may well be a more transmissible variant gets added to it as the summer progresses, and maybe a bit more vaccine escape. We're going to need booster shots in the autumn, and then how long is that going to take? And being up to 100,000 a day, then it's going to be far harder to control this with vaccine than it would have been if we kept it low through the summer. So it's whole, and then the most bizarre thing of all, we get them saying, and we've got to delay it because in the summer, because it's seasonal. They say we've got to delay it because it's going to surge in winter, and they say that while it is surging in summer. Flu never surges like this in the summer. It's just so bizarre that our government are saying, look, we've got to delay it, we've got to let it surge now, because we've got to let it open up now, because if we leave it to the winter, it will surge because it'll be winter. And it's surging in summer, and the opening up while it's surging as fast as it's ever surged. What sort of logic is that? In what way does it make sense to say that it's seasonal? And the World Health Organization see no evidence of seasonality yet in COVID. Maybe sometime with new variants eventually it'll become seasonal. It is not at present. And we can see that with our own eyes looking at the figures of the graphs going up in the United Kingdom. It's absolutely certain it's not seasonal. So anyway, I just wanted to I'm trying short videos, and so I'm trying doing it just by going through my tweet threads. I thought that might be a way to do a short video, and so I can add that to that tweet thread perhaps. So that's what I'll do. That's enough for now. I'll stop it. I will try a few more like this.